Hi, my name is Dr. Michael Chen. I work with Dr. Demetrius Lopez here at the Rush Center for Neuroendovascular Surgery. I'm going to talk a little bit about cerebral aneurysms. Oftentimes patients have a lot of questions and there's a lot of fear associated with the diagnosis or the new diagnosis of a cerebral aneurysm. Basically, an aneurysm is a weakening in the wall of the artery in the brain, and the main reason why we're concerned about them is that they pose a risk for bleeding in the brain, which is potentially a life-threatening situation. And the larger the aneurysm is, the higher the risk that this may end up causing bleeding. If we treat about 150 to 200 patients each year here with bleeding aneurysms in the brain, and the question isn't necessarily if the patient should be treated, but when. And here I work with Dr. Lopez, Dr. Lorenzo Munoz, and myself. We were able to figure out really what's the best, safest method for excluding that aneurysm from the circulation and really addressing the risk of that aneurysm causing any additional bleeding. Then the focus can be then directed towards helping the patient recover from the bleeding that's already occurred. If we're talking about an aneurysm that has not ruptured, that's a little bit of a different story, and it's a bit more nuanced in terms of the discussion that we have. We look closely at a lot of features, including the age, the location, the size, the morphology, and many other medical comorbidities or other features to your case that are unique, and then try to determine what's the best method, first of all, if treatment is necessary, and if so, what's the best approach. Basically, the goal of treatment is to address this underlying defect and seal off that weakened wall so it's no longer exposed to continuous pulsatile arterial blood flow. If you have any other questions about aneurysms, how they form, grow, and possibly rupture, as well as what the treatment options are, please feel free to contact either Dr. Lopez or myself, and we look forward to helping you out with this. Thank you.